So thank you everyone for joining the session, and this is our session for Psychep 301. Dr. Henny is going to take the session for us, and hopefully everyone will enjoy. And Dr. Henny, in the beginning, I want to know a little bit about, yeah. So, oh, sorry, it's for me. It's also a little messed up. Early morning for us here as well. Yeah. So, thing is here, maybe you can tell them about your uh, study hours during while you were preparing that time. I mean, the getting up in the morning to like the end, maybe they can also adjust few things that way actually. If you can
So,
highlight that one a little bit.
yeah, sure, great question. So throughout my, so I encountered COVID in a period where the exam were canceled, so it was a bit lengthy for me, the whole journey of preparing for the AMC clinical exam. So it kind of fluctuated throughout. So for some period of time, I was working full time, but and studying at the same time. And in the past 8 months, where I was studying full time, I had to wake up 9 a.m. Sydney time, which where I was in Iran back then, and I had to wake up like 2:30, 3 a.m. to study because my study partners were in Australia. So that's how it worked for me, and we studied from 9 a.m. to 4 p.m. every day. We role played. It was a group study, and the rest of the day, um, 4 p.m.
Means
Australian,
how many hours there? I mean, in the early morning,
with
so how
seven,
many
eight
hours?
hours, 7, 8 hours at
Okay,
least.
7, 8
We
hours.
were role playing, and there was a little break. We were a group of four, so each of us tried to role play, um, prepared 4 cases and delivered to each other. So each of us role play 12 cases every day. This is how we studied. And then the rest of my day, I used to just do my self study. But my sleep pattern was pretty
Mhm.
messed up because of the time gap between where I was living.
Yeah,
So my time frame was I woke up 3
hard
a.m. in
work
the
paid off
morning and
eventually.
slept,
That's
yeah,
okay.
yeah, and 5
Yeah, hard
p.m.
work paid off. That's
Yeah,
most
thank
important
God
because
it
not
paid off.
everyone.
Yeah.
Yeah, because not everyone passed the MC to in single go, but I can see, the dedication and things all of you provided. So the summary of this thing is, uh, I want to add to others as well, that it's very, very important that, others can also, get some inspiration from that story. And so you can see one thing that it's almost like a 12 hours of study time period or something like that doctors are studying actually. So it should be continued, and don't give up that you don't have a exam date. No, and another thing I want to go back, Dr. Henny, that when you don't have exam date, that time how many
Yeah.
study hours you have actually? Because once you have a date, it's very different than once you don't have a exam date.
Yeah. So maybe we didn't do it every day or 5 days per week, as regularly as I did as a student, but I still had my role play sessions every day. So maybe at least 4 or 5 hours I still did role play. Or when I was working full time, I still squeezed in the time, which kind of interfered with my working and was very difficult to manage. But still, I was attached to a study group and was studying, but not
Somehow
as
connected.
intensively. Yeah,
Yeah.
4 or 5 hours at least.
Yeah. So another thing they can correlate because you have also gone through our academy before, so using the notes. So the here's the summary thing also, like, so apart from the SMA notes and because videos we also give for longer time. So apart from those things, uh, and how you are using some of the contents, like there are some contents in the MC clinical exclusive, the new cases came up. So how you are coping up with that one, apart from the class things, because class thing is the one thing which it makes the baseline and the things, and then on the top we have to keep searching with the new cases. So how you are coping up with that one?
So that's what we did. So as a group of four, we were assigned to 4 cases each, and we had to extract everything related to that case and teach each other so that 8 hours or 4 or 5 hours was not solely role play. We did our performance, we gave each other feedback, and at the end of each session, we teach the cases we were assigned to. We taught that to each other. That was pretty much how I studied, and I tried to cross-check it with each note. It wasn't like I just printed out Karen notes and was studying Karen notes from A to Z. It wasn't working like that. I used your Google Drive, Dr. Shahriar, the one you
Yeah.
shared with us, and I tried to search for the keywords of each
Yeah,
case and
that's
find
what
similar
I also
cases.
tell like them at the same time. Like, we do provide the notes and everything, but there should be something of your own. Like, are you also providing knowledge on the top of that one? Like, that's the most important thing. Here's things are not like a ready-made thing, and they also don't like to hear always big things ready-made. So, if you improvise something, as you have also gone through, you know it well, that if you improvise something that reflects on the exam eventually. So this is
Okay.
recommended to all the aspiring doctors, those are coming, and actually those are listening as well at the same time. I hope so. This is some of the tips. So any last tip before we get into the session?
Yeah, just one. If you want to wrap up this exam, it needs a lot of effort. It needs a lot of time. Even though you're all very good doctors, I'm pretty sure, but you have to put the effort of familiarizing yourself with this exam and practicing and knowing how to play according to the rules of this exam. So it's not going to happen without putting effort, definitely.
So thank you so much, Dr. Henny, for